welcome everyone to our Pozen-Commonwealth Fund Fellowship in Health Equity Leadership here at Yale University. We're just going to give people a minute to come in and then we'll get started in just a minute.
Yeah.
All right. I think Wendy, we're good to go.
All right. Well, hello and welcome everyone to the Yale School of Management for Executives panel for the Pozen-Commonwealth Fund Fellowship in Health Equity Leadership. My name is Wendy Sung, and I serve as the Assistant Dean for the MBA for Executives program. And I'm joined today by Dr. Howie Forman, Faculty Director of the Healthcare Specialization for EMBA, Dr. Marcella Nunez-Smith, Faculty Director for the Fellowship, and Dr. Nazleen Bharmal, alumna of the EMBA Class of 2023 and a Pozen-Commonwealth Fund Fellow. Thank you for joining us today to hear about the fellowship at the Yale School of Management and the significant roles our panelists, fellows, in this program plays in solving for inequities within healthcare and dismantling structural barriers that exist within the healthcare system. Through them, I hope you'll learn about the mission of the Pozen-Commonwealth Fund Fellowship and the significance within the Yale's MBA for Executives program. And we will definitely save time at the end to answer your questions live. The Pozen-Commonwealth Fund Fellowship is sponsored by the Commonwealth Fund and the Yale School of Management MBA for Executives program. And it's also endowed by a generous gift from Robert C. Pozen, a member of the Yale Law School class of 1972. For those of you who may not be familiar with the Commonwealth Fund, it was established in 1918 by Anna M. Harkness with the mandate to do something for the welfare of mankind. The Commonwealth Fund promotes a high-performing healthcare system that achieves better access, improved quality, and greater efficiency, particularly for society's most vulnerable, including low-income people, the uninsured, and people of color. I encourage you to stay until the end of the session to learn more about the admissions process if you're interested in the fellowship. And if you have any questions, please put them in the Q&A session or Q&A button as we go along. So as we get started, I want to take a moment to thank our panel of esteemed healthcare experts for being with us today. I know you're all incredibly busy and in demand, but committed to taking the time to talk to us about this important opportunity to make a difference in healthcare through leadership. So it's my pleasure to allow our panelists to introduce themselves. And if we can start with Dr. Forman.
Hi, I'm Howie Forman. I'm a professor of radiology in the medical school and of management at the School of Management. And I've been attached to the management school since 2001. And am really proud of being a co-founder and the senior advisor to the Pozen-Commonwealth Fellowship, along with Marcella Nunez-Smith, who I think I can pass it to.
Thanks, Howie. And thank you, Wendy. This is always a highlight to join everyone for this panel. So I'm really looking forward to our conversation. And I have a little smile because Howie is so generous in the credit there, but this is Howie's vision that has come to be materialized. And I just feel so fortunate and honored to serve as faculty director of this fellowship program. I'm Marcella Nunez-Smith. I'm an internal medicine physician. I'm a professor of medicine as well as management. I'm associate dean for health equity research over here at the med school. And I am so excited about this fellowship program. And I love seeing Nazleen. I love getting a chance to be with you in this space today. So I'll pass it to you.
Thank you so much, Marcella. Thank you, Howie. Great to see you, Wendy, as well. It's just great to be here. I'm calling in from California, and I'm Nazleen Bharmal. I'm a primary care physician, and I'm the Chief Health Equity Officer at Stanford Health Care. I'm also an associate professor in clinical education in the Department of Medicine at Stanford School of Medicine. And I am just thrilled to talk about the fellowship. I'm a super fan of all the people who are here on the panel, but also of the fellowship and of the program.
Thank you, everyone. Maybe if I can start with Dr. Forman, Howie, you talked a little bit, you mentioned you've been with EMBA from its very beginning. I'd love for you to tell us a little bit about the origin story of the MBA for Executives program, how we started in healthcare, and how the fellowship came about.
Sure. So people on the call, many of them may know that Yale is a unique university in its objective to serve society and not just serve the students per se. And so the School of Management, which is in its 50th year right now, is the 50th anniversary year of the School of Management, is a latecomer to Yale University, but very consistent with that theme. It was founded as a program that delivered a Master's of Public and Private Management, not even an MBA program until the late 1990s. And with that mission, which they have maintained until this day, it was very natural that healthcare would be a core content area for the School of Management, dating back to before I arrived here when Ted Marmor, who unfortunately passed away last week, would teach health policy to the School of Management students. I started teaching here in 2001 because our MD MBA program had just begun, and that program was doing very well for a few years, and the School of Management wanted to launch a executive program. And so the only executive program we launched in 2005 was a healthcare executive MBA program, an MBA for executives, leadership in healthcare. That turned out to be a highly successful program, and we were fortunate to be able to build that program out, very much to the credit of Wendy and others in the office. And by the way, this is all a village, and it does take a village. But the program was built out from a small healthcare EMBA program to one that now has 3 areas of focus. And additional non-focused MBA program for executives. But along the way, about 8 or 9 years ago now, and someone can correct me if you know the date, I got a phone call from consultants to the Commonwealth Fund asking what I would think for a program that was training people who were passionate about at the time they described it as minority health policy. Later, we expanded that to really be health equity. And what would be the things that we could add to such a program that would make it unique and that would be things that Yale specifically could offer? And the anchor was the EMBA program, but also the fact that Yale is a very integrated university with a school of medicine, a school of public health, a school of nursing, with a school of the environment that is committed to environmental health, with a law school, with the Solomon Center for Health Policy. So many areas. I could go on and on about why Yale is ideal for a health equity program. And to make the long story short, Marcella and I met probably 48 hours later and talked about the excitement over that possibility. We competed for the program, and about a year later, the Commonwealth Fund awarded us this opportunity to train 3 people a year in health equity leadership. And as was already mentioned, Bob Pozen came along just a few years later and further helped permanently endow a program at Yale so that we can continue to do this, hopefully for a very long time to come.
Thank you, Howie. And Marcella, as faculty director for the Pozen-Commonwealth Fund Fellowship, can you talk a little bit more about how the fellowship is designed to support leaders in health equity, what you would like to see the impact for this fellowship have on leaders and within health equity?
Yeah. Oh, yeah. Happy to. Let me first echo Howie's note of appreciation to the village for this program. So thank you, Wendy, your entire team. EMBA has been an amazing partner and home for this program. We are so lucky. And the appreciation, extends. I think it's important for everyone to know that the fellowship is supported through these 3, I think, really generous grants and gifts, right, from Bob Pozen, from Commonwealth Fund, and from right here at Yale to make this program a reality. And I also want to talk about our own leadership team having grown over the years, right? And we're so fortunate to have Dr. Rosanna Gonzalez Colasso as our associate director of the fellowship program, and a graduate of the inaugural cohort of Pozen Fellows, Dr. Cece Calhoun, who joined us as assistant director of the program. So as our family of alumni grow, and I'm looking at Nazleen and just can't stop with the beaming, like as our community of alumni grow, it's been wonderful to be able to grow our leadership in this way and also have the support of the folks at SOM, but also, as Howie mentioned, across the university where we have so many assets. Yeah, so I'm particularly excited to be here this year talking about the curriculum, Wendy, because we're achieving all of these various milestones. When Howie says, "Wow, was it 8 or 9 years ago we got that phone call?" It's right. I mean, we have got quite some tailwinds behind us. So we've gone through many iterations and remain committed to being incredibly responsive with this curriculum. But I think it's at this wonderful point of maturity where we know the elements that are high yield for our fellows and what contributes to the long-term impact. So like Howie said, this is anchored on the MBA, which is rigorous. I know Nazleen will talk more about that. We don't want anyone to think that this is an MBA on the easy. This is a hard program. So we take that into consideration too with the fellowship design, knowing that that is a very, very serious, intense, educational, rewarding experience for our fellows. And then there are elements we tie on. The Thursday night is a highlight. So on select Thursday nights of the year, the fellows will gather in community, the first and second years, with a very individualized, tailored curriculum to the fellows in the cohort, but based in very specific learning objectives for our fellows. We also have these immersion experiences that are really thoughtfully designed that occur at the beginning of every academic year. That's a chance to really be immersive together for a couple days in community. Much of our work is going to be about expanding our knowledge network. So at all these opportunities, bringing in key leaders across various sectors who have been making difference in the healthcare equity space to share their learnings and their knowledge. We also go down to Commonwealth for a policy day, which is critical to us. We get to be in community with the other fellows supported by Commonwealth, including with our sibling program up at Harvard. Really important for us too. And of course, I think Nazleen will talk more about this too, our capstone, which is a unique element for us and our fellows. But I think all along the way, the idea is having a community of mentors and peer mentors and others really at the ready to help fellows think about what their own goals are for their program to achieve that. And we are grateful that we can individualize the program in that way.
Yeah. And Marcella, you talked about sort of that nimbleness and customization and really helping the program to be impactful for the leaders. And as all of you on this call knows that over the past several years, there have been so many changes that have impacted the healthcare industry, especially concerning research and funding and even job security. So as leaders of the Yale School of Management and thinking through sort of your involvement with the Pozen-Commonwealth Fund Fellowship, how are you thinking about addressing all of these challenges? And what have you sort of brought into the fellowship to help our fellows make such an impact in this space?
Yeah, it's the right question, Wendy. And it's a big one, right? I could certainly take the rest of the webinar to talk about all the changes and the impact. But I think it's really important to highlight that that responsiveness, right? And I think if ever there were a moment where having the skills of an MBA are going to be necessary and at the core, it's now. It's always been thinking through creatively and innovatively in a resource-constrained environment. That is where we start. And so most certainly that's always been there. But now there is a lot that we have to do in terms of thinking through our climate and where we are, how we make sure people understand what health equity is, right? Where people understand the real quite sad and astonishing reality of the number of folks who are affected by the fact that we have inequities in our system. And it goes very broadly. People are often surprised when I talk about disparities that we see by geography, right? By place. So many folks, right? whether it's urbanicity, rurality, right, being significant drivers of differences, age, just one of the most stubborn and persistent disparities that we see, right, separating over 65. And now we're seeing disparities in the younger populations too. So I think it's always been important for us to be able to communicate exactly what our goals are, what we're achieving, and how we're talking about the collective when we talk about equity. And bringing that business model to it has also always been an imperative. So I think we, to your point, we have been very intentional, very mindful about curricular updates, revisions. We have completely honest conversations, right, in this fellowship. But I would go back to the beginning where Howie said that conversation 9 years ago was about putting the skills of an MBA in the toolkit of folks who understood equity to be an anchor for quality in healthcare. And so we go back to that time and time again, right? And it's not to say better than other degrees. There are many paths, obviously, to contributing to that conversation and health equity. But this is an important one. And quite frankly, it hasn't, was missing. And we've been able to fill that gap with the Pozen Fellowship.
And I also think that the fellows bring into the EMBA classroom their experiences, and that really creates a wider impact for all of our students to understand better health equity and the implications in their work as well. Nazleen, I'd love to have you talk a little bit about your experience. You've had several roles at the U.S. Department of Health and Human Services and the Cleveland Clinic before you started your MBA. Can you tell us a little bit more about your positions at the time? What drew you to the Yale EMBA program and the fellowship? What inspired you to apply?
Yeah, I think there were several factors. So my prior role before joining EMBA was actually I was a health disparities researcher, and I spent a lot of time describing disparities, but not knowing what to do about them. And that led to a role in the federal government where I was the director of science and policy at the Office of the Surgeon General, partly in the Obama administration, partly in the Trump 1 administration, and got to see, using the policy lever, what could be done. And a lot of change happens locally. And my most recent role before joining the Pozen Fellowship and the class was to be the Associate Chief for Community Health and Partnerships at Cleveland Clinic, which is 12 hospitals in Northeast Ohio, and thinking about a community health strategy that also tailors in with population health. And what I found was that we were doing a lot of pilots, but when it came to the conversation about how to scale this, either at the hospital level, the community level, the region level, there was just something that was missing, even with all the broad experience I had already had in my toolkit to help patients, families, and communities. And so when I saw the fellowship, Marcella was a drive, and so was Howie. Quite frankly, I knew about their leadership. I knew about their expertise, both as leaders in business, in healthcare, and in health equity. The Commonwealth Fund is a very trusted think tank, both as a think tank and as a philanthropy organization. And I was reading all of their weekly newsletters about what is up and up in healthcare. And I was like, and it was also at Yale. And so I think all of those reasons were sort of looking at the ecosystem of being sort of part of an academic center, thinking about the people who are running the program, thinking about it associated with the Commonwealth Fund. I thought, wow, this is absolutely an experience to think about what I'm doing today and trying to implement and how to get that to scale. And yeah, so that is what brought me there. And I absolutely got that from the fellowship and from the program.
That's great. And now you're in a new role as the clinical associate professor in the Division of Primary Care and Population Health at Stanford School of Medicine, and also the Chief Health Equity Officer of Stanford Health. How did both the EMBA and the fellowship prepare you for these roles and really impact your leadership ability in general and the impact that you're able to have?
Wendy, being the Chief Health Equity Officer at any institution, it's like a dream. When I came into the EMBA, I was not thinking about that. Honestly, I honestly was fine with staying in my current institution. And implementing all of these changes there. And, over the course of 2 years, what's really interesting about being back in school and what somebody had told me is that it gives you the ability to take a step back and just dream. And that is really what happened. And I took a moment back, and again, not really thinking about a role per se, but thinking about, I want to gain these skills because I really want to make impactful change, again, for patients, families, and communities. And so what the fellowship taught me was a number of things. Yes, it taught me the analytics work. It is a very rigorous program. And so really taught me some of those analytic skills, which quite frankly, I thought I had, but at a different kind of level and at a different kind of rigor, quite frankly. It taught me a lot about management, but I think the greatest thing that it taught me from the fellowship program was instead of being asked to do roles, to advocate for what you want in those roles and to actually imagine what would be sort of the role that you could make the greatest impact that also meets, your skill sets and your passions. And so throughout the entire program, whether it was talking to the National Advisory Committee, whether it was talking to the speaker, whether it was talking to my fellows, whether it was talking to the teachers who were teaching the classes and who are just part of the ecosystem of being at the Yale School of Management or the greater community, I think, thinking about that ahead of time, all of those threads helped me to be, in my current role today. I would say in my current role, one of the most attractive reasons that they could have taken an internal candidate, but one of the most attractive reasons was actually having the MBA and the MBA and knowing that I would be able to talk to the chief financial officer, the chief medical officer, the chief operating officer, and CEO, and understand that the business of healthcare and the healthcare system is not mutually exclusive from helping communities and community health. So I think that is what they really appreciated. And they told me that when I accepted the job, that was one of the reasons that, that made it very attractive to be in this environment.
Thank you. And, the MBA, I often hear from students that it's really a transformational experience and it taps into things that you don't even know that you didn't know about, right? And learn from that. And so it allows you to dream bigger and think bigger and connect with students from different backgrounds to allow you to develop those relationships as well. Marcella, in hearing about Nazleen and also from you in terms of all of these different components of the fellowship, in addition to the EMBA curriculum, can you talk a little bit about a little bit more about sort of these additional opportunities that are available to the fellows and how these opportunities, like the speakers, really challenge and help our fellows grow?
Yeah. Definitely. And, thank you, Nazleen. And so the idea with the additional curricular enhancements, right, for the program is exactly that, to make sure that we are complementing what our fellows are already getting from the EMBA. And I'm really glad Nazleen mentioned the NAC as one example. So the National Advisory Committee. As you mentioned, we are very lucky, right, to have so many people say yes when we invite them to be of service to their fellows. Howie and I and everybody else, right, we ask these favors, and we're fortunate to have these relationships where people will say yes and give up their time, either as members of the National Advisory Committee, and Nazleen mentioned having that chance to meet with healthcare leaders multiple times a year. They're always available for the fellows too. And especially in those Thursday night sessions where we invite speakers in to share, right, their professional journeys and often their personal journeys too. Key is the lessons in that session, but also the fact that those individuals are now available to all of the fellows as ongoing mentors, advisors, sponsors, really importantly, has been key. Our fellows, I certainly am not going to speak on behalf of them, but it's been wonderful to hear our fellows talk about the high value of being in sort of that closed community with the other fellows in spaces like the Thursday nights to go deeper in that small cohort setting. And being able to also engage, I mentioned briefly that the Commonwealth Fund supports many other programs too, and being able to engage with fellows across programs has been a real asset, I think, for our fellows as well. So, and then of course, the capstone, which we'll circle back to. We're very anti-busy work. So everything is about the yield, the rate of return on the work that you do. And it's been, I think, a very affirming to see fellows take advantage of that capstone opportunity and parlay that into either their current employment or their next employment opportunity, project, program, initiative. So we're really big here in making things count twice. We're always going to make sure our fellows, through these enhancements, have the skills, the relationships necessary to help them achieve both their career objectives, but also what's needed in the field.
Great, thank you. And I know there are a lot of questions about admissions, criteria, and what are we looking for in fellows? I do want to get to that, but before we do that, I'd love for Nazleen, to share a little bit more about sort of how you balance this, because we've talked about how rigorous this EMBA program is on its own, but add to that sort of all of these wonderful opportunities that are part of the fellowship. Which is sort of a step up from sort of what's required of the EMBA. So can you talk a little bit about how you balanced all of these priorities, your travel, your work, your personal life, and all of this to come to New Haven, to be engaged in the EMBA and the fellowship?
Yeah. First of all, I wanted to say, I want to reiterate, the previous fellows before I started gave a lot of input and advice, and we have continued that tradition. And so you join the program if you are fortunate enough to be a Pozen. I want to let you know you're coming into a family, and we're here for you, and we will absolutely help you through this. I was traveling from Cleveland, Ohio to New Haven, and I just want to tell everyone there is no direct flight from Cleveland to New Haven. And quite frankly, I am married. I was, in the middle of my career. I have two children, and at that time they were middle school age, elementary to middle school age, and it was hard. So I would say life is like a fine balance, and this we're just coming out of COVID, a fine balance. And if one thing in your life is a little off, like it will be a challenge. And so I think thinking about it in advance, making sure you have the support in advance helps. With the help of other fellows, was able to help think about what my travel would be, make sure I got a credit card that got airline points, be very strategic about whether I would take a train or a ride share or whatever to get to New Haven. Think about the Thursday night. You cannot miss the Thursday night. It's a mandatory requirement. And I would say I was there in person, because the greatest gift of this program is being in person in fellowship. Again, with your classmates, your other fellows, with the speakers and the professors. So, but it is a commitment. It is hard, and it does require some planning. But I think it's definitely, obviously feasible and possible to do afterwards. And I will also say I have really enjoyed the gift of time coming back out of the fellowship and being like, so that has also been a wonderful gift after completing the EMBA.
Yeah, I often think that our students not only graduate with their MBA degree from the Yale School of Management, but they graduate with a completely, advanced degree in time management, right? Because they're able to do so much more. And you realize the capacity, how much more you have to do more by, sort of optimizing your life, right? So.
I will tell you also, just that time though, the Thursday, Friday, Saturday, that time, and to be away from your comfort environment or your work environment, I just cannot emphasize enough about how special that is, and what a privilege it is to be able to do that, and to be fully immersed and concentrating in whatever you're either learning or, meeting or networking with, and just it is just absolutely invaluable and just such a special friend. I continue to stay very much in fellowship with my cohort of fellows. We actually connect pretty regularly, quite frankly, as well as the larger group. And I'm specifically talking about the Pozens in addition to my.
Yeah, absolutely. Like I said, there are a lot of questions in the chat around, or the Q&A around how do we think about sort of candidacy for the fellowship? So I'd love for Marcella, you and Howie maybe to talk a little bit about sort of the candidate qualifications for the fellowship and for the EMBA program, because they kind of go hand in hand, and how we can ensure the maximum impact from participating in both the EMBA program and the fellowship.
Great. Thanks, Wendy. Howie, you want to start?
I mean, I would just say that, and to try to quickly answer some of the questions that have already come in, obviously we must, a candidate must be capable of doing the EMBA program, which is a very rigorous program, as Marcella and Nazleen have conveyed already. And so there is a standard to get into the EMBA program. Having put that aside, we are looking for people, as people have asked, early to mid-career professionals who are clinical facing, who have the time available to them to do such an intense program, and who are already working in the health equity space. We're not looking, we would love to have a program to help people pivot into the health equity space, but that would probably be more properly assigned to the School of Public Health or to another program at Yale than the Pozen program, where we're expecting you to come in with already demonstrated leadership in health equity. I ask you to add on to that, Marcella, and maybe Nazleen as well.
Yeah, I totally agree, Howie. I think that's so important. I mean, I can absolutely underscore, especially on the fellowship side. So I think it's important just for people for transparency, that we're working, very closely together in this admissions process, the fellowship leadership team and Wendy and her team in EMBA, because it is very important that the people who come into this program are going to find success in the MBA, right? And that is number one. And so we really only consider fellowship applications from, a pool of people who really are going to be competitive for the MBA. Really important to echo what Howie said about, sort of what are we looking for in a fellowship applicant? I will often say this is health equity 3.0 for people in their careers. So, just think about that. We welcome, everyone needs to be part of the health equity journey for sure. But this is a program, a PACE that's going to presume that you have been working in this space for a long time, that you're coming in already with established both expertise. There's an entire field of science here, so that you're coming in with expertise and experience, demonstrable experience leading in health equity spaces. So I would keep that in mind as one is considering their applications for the fellowship program and for the EMBA. But yeah, Nazleen, you want to add anything?
No, I mean, yes and no. I would say, to be able to have real conversations about what is happening nationally and internationally around health equity, how to advance it, how to integrate it in whatever field you are, how to be a leader in it, you really do need to have that experience and elevate that conversation. This fellowship, the Pozen Fellowship, also attracts people into the EMBA program who may or may not have successfully gotten the fellowship. So I just want to be very clear. It's very special to be in the Yale School of Management, specifically because of this fellowship, because equity comes up in your classes, in your program, because your classmates are also thinking about that and are aware of this fellowship. I also just want to talk about the process and the application. So I have been in a lot of graduate programs. An MD, I have a PhD, and I had a master's in public policy. And this was the most rigorous. So I want to be very clear about it. I think of it as taking 2 years of an MBA and doing it on the weekends, like in class and then throughout. yes, I didn't want to do the EA, the executive assessment. I was like, why do I have to do that? I did it. It was painful, did it. But I just want to let you know that, both the quantitative and the qualitative parts are both have rigor in them. And so please think about that. Think about that. Think about where you are in your career. Think about if you are a frontline healthcare provider or clinician, and think about what this would mean to your family and to your work to be part of the program, because you really want to be in it to be able to participate.
Yeah, and you want to be able to commit the time to getting the full benefit of not only the EMBA program, but the fellowship. Nazleen, to your point about the executive assessment, which is the standardized test that we require for all applicants, not just for the fellows, for all EMBA applicants. It's something that, it's kind of a marker for you to consider, do you have the time to study for the tests? Are you willing to take tests? Because as soon as you come into the program, that's what it is. You're going to go through your classes, you're going to have to make the time to study, make the time to take your exams, right, to move forward. And so if you can't find that time or you're reluctant about taking it, then maybe it's not the right time for you to consider this program or this fellowship.
Yeah. And two things. Oh,
yeah, please.
Oh no, totally, Wendy. And sorry to interrupt. Yes, I would say, and likely when Keith comes on to talk more about the program, he may talk about this too. We are often in conversation with people for many cycles, right? Because it is important to get that timing correct. And we are happy to do that because it is important for success that the timing be right. So I'm echoing that. And then I was going to ask you a question, Wendy. I know, I'm going to turn the table, which is around the role of employers in the process, because I think there are a couple of questions, and you probably can speak best to the way that EMBA thinks about the employer and employer support.
Yeah, absolutely. As everyone has talked about, sort of the commitment required. The people that we have in this program are working professionals. And that means they're fully employed, they're working at their jobs. And we feel that those folks are the ones that are best able to contribute to the learning in the classroom, not only for themselves so that they're able to bring the content back to their work immediately and add value to their employers, but also to each other for the broader cohort, so they can talk about their experience and what they're learning. But it's so important to be fully employed while you're in the program. And have your employer support, because this is not sort of something that you can just sort of work and go to class at the same time on your Fridays or Saturdays. You can't sort of try to double time it. You have to be fully engaged in the classroom, and you need to get your employer's support in that process. And we do require employer sign off for the time that you're going to be away from the office. So there was a question that came through, and I'd love for you to talk a little bit about the overlap between the year 1 and year 2 fellows, and how they engage with each other, and do they have sort of mentorship or anything like that?
Okay, maybe Nazleen can start.
I'm happy to start. Yeah. There is definitely overlap. You actually are in an immersion program before being part of the Pozen, before the program starts. So you get to be with each other, the two plots of cohorts together. There's also alumni that come back, and you get to interact quite a bit with them in terms of helping you throughout the journey. So there is direct overlap. We also have a WhatsApp channel in case people are interested.
That's what came to mind first. I was like, they're always WhatsApping together. Yeah.
Communicate with each other. But yes, in person, and you'll see each other on not just the immersion program and the Commonwealth visit, but you will see each other on Thursday as well. And then I just want to I thought about applying to the fellowship. I graduated in 2024, but I actually thought about applying 2 years earlier. And the reason, and I chose not to because I just wasn't ready. It was with both of my employer and at the time. And I would say the employer part is just so critical. The employer actually supported, after going to the immersion program with this, fellows who were second years, they told me you should ask your employer to cover your travel. And my employer did. And I would have never asked her. This is like how we help each other as fellows, not through just our capstone and through our classes, but these kinds of things that happen in sort of your regular work environment and how to sort of manage up.
And Nazleen, I also love for Howie to talk a little bit about sort of how the first and second years overlap, because it's not just in the fellowship curriculum where they overlap, but also in the colloquium course.
Yeah. I mean, we have a wonderful colloquium that covers all three focus areas, areas of concentration, and healthcare is obviously a main one of them. And the engagement of our Pozen fellows in those sessions in particular is always notable. And it's a place where they get to engage with each other members of the class, and people that are outside of healthcare. The thing about this program that I think has been most surprising is how much it has influenced people in the other tracks, people who have nothing to do with healthcare, but who become so well educated and so much more aware of the world that we live in through both the colloquium and other classes they take together.
So I do want to leave some time. Oh, sorry, there are a few more questions, more around sort of given that there's such qualified candidates that come through the program, how do you think about sort of what rises to the top? Like what kind of traits might rise to the top for the fellowship?
Great. I can take that one really quickly, Wendy, and then turn it over to Keith. So, I want to emphasize that we are, having that sense of community, even family that Nazleen talked about, it doesn't happen by accident. So we are incredibly attentive and thoughtful that we are not just selecting individuals, but we are inviting a cohort into the community. And so we're thinking a lot about those individual traits. Many of those we've already discussed today, like signals of success while here at Yale, that health equity 3.0 readiness, being on the cusp really in career is important for us. We're also going to think about, not just what the Yale MBA and the fellowship will provide for that individual, but again, the gifts and talents that the individuals will bring into our community. So I would say that is very important to us. We are building a deliberate cohort that's one that will be synergistic. And we want to be able to know the fellows are going to work well together. The fellows are going to have that spirit of generosity and contribution, both in the fellowship and in the EMBA. So that's really important. We do have an interview part of this process that I'm sure Keith will also discuss, that is as important as all the other parts of that application. Before I turn to you, Keith, though, I would be remiss. I am standing right now at the Equity Research and Innovation Center at Yale School of Medicine. I would be remiss if I didn't say this is the Yale School of Medicine home for our fellows, yet another community the fellows have access to. Many thanks to the faculty and staff, the team here at ERIC, who are very generous with the fellows, particularly around that capstone. And we welcome the fellows into this community also. So with that, I will maybe pass it to you, Wendy, to pass to Keith.
Yeah, absolutely. And like you said, Marcella, it does take a village in Howie as well, right? It's there are so many people involved in this fellowship and rooting for the success of all of our fellows. As a closing question, before I pass it to Keith, though, if you can all offer sort of one piece of advice that you would give to prospective students who are interested in the EMBA program and the fellowship. Maybe we can start with Nazleen.
Yeah, I think I've been saying it throughout. Like, think about it before and what it would have been. But I'm a big believer. You should just apply. Apply, do the thing, feel what it feels like to do the application, to do the EA, to be on the interview, and see if it's the right match for you.
Great, thank you. Howie?
I would tell you to engage with the program office early and often. There's a staff that goes well beyond Wendy and Keith. There are people that are always there to answer your questions, and I think they can be enormously helpful.
Thank you. Marcella?
Yeah, well, I want to thank everybody for joining today. Thank you for your interest in the program. I'm going to totally cop out and just say, yes, you should absolutely engage with Keith and his team as early as possible and apply.
Thank you. Thank you all so much. And I will pass it over to Keith. I know you have a lot of great information to share with everybody on this call.
Yeah, no, I really appreciate it. And thank you so many. Please know that we've definitely been reading your questions. I think there's one thing before I jump into the presentation, and maybe Howie and Marcella, you can help kind of address this. It is a very competitive fellowship. We would love to have as many as we possibly can. But the reality is that usually every year, three are going to be selected. And so often, people who meet all of the criteria, we don't end up selecting them, but they end up enrolling in the EMBA program anyway. And so I think it's really important to know, what is the main goal really is the EMBA program. And the fellowship sits a bit on top of that. And I'll go through that in my slides a little bit, but I think maybe Howie, you've talked about this a lot. What is the real value? Why did somebody come to this EMBA program?
Yeah, I mean, I think the principle that we follow is that we're trying to teach you how to think, not what to think. And that if you come here with your values and your objectives, we're going to give you the tools to be able to be a more effective manager, a more effective leader, and someone who's able to both personally self-actualize as well as operationalize your vision for a better future. And I know that sounds cheesy, some of those words, but my God, having done this now, teaching at School of Management and being a teacher at Yale for 3 decades now, it's just true. And I went to business school in 1994, so I can say it changed my life. There is an enormous opportunity to make a difference in the world, and sometimes we don't have the tools to do what we need to do.
Yeah, thank you very much. And the other question really that's come up a number of times, and it comes up to me all the time, is do you have to have an MD to be selected as a fellow? And I know if you look at the fellows going back into the past, that really was a requirement at the beginning, and it's since maybe expanded and into different roles. But I think that it really is important to note that a clinical facing position at some point in your career really is one of the key criteria to be selected as a fellow, not necessarily for the EMBA program, but we have some wonderful people that are doing great work in the technology space and other things. But I think and maybe just clarify that a little bit so people are clear that we really would like to see some sort of clinical experience at some point in your career. That's correct?
Yeah, that's correct. Thank you, Keith. That's really important. And to the same point Nazleen made earlier, the reason why we're looking for folks who also have an advanced health equity understanding and track record is because when we are in those small group learning opportunities, it's critical for people to sort of start with some shared background and baseline. And that clinical facing part of your career, we think, is also essential to be able to both contribute and gain from that. But I would want to talk about just how incredibly rewarding and rich it has been for me to have the opportunity to meet people who are applying to the Pozen, and maybe for whatever reason, sometimes it's the clinical piece, sometimes others, they're not ending up in the fellowship, but they end up at Yale in the EMBA and thrive and do really well and make great relationships with the fellows. And in fact, we just had some alumni come back and join us during immersion who really embody a lot of the values, but even, it's just, again, across sectors, different, not everyone's going to come in with that clinical background. So I want to emphasize just how welcoming the EMBA will be, regardless of whether you're a clinician or not.
Yeah, and what I want to do is I want to wrap up the presentation with a very short kind of admissions light presentation. We have much more extensive presentations that we will go through, but can everybody see my screen? I just want to make sure it's the correct screen. We have lots of things going on. Great. So, one of the things we did talk about a lot throughout this call is what is the structure of the program. It is primarily an on-campus program. It is an on-campus program. And what it does is it starts off every year. We bring in one cohort of students to the EMBA program every year. They start off in July with a 2-week residency. And then it goes from August until May to an every other Friday, Saturday format. Classes are all all day on Friday, all day on Saturday. There are some additional activities that happen Friday night to connect you to the larger Yale community. There's often guest lectures that will come in that are optional at the end of the day on Saturday, but many of our students are going to start making their way home at the end of the day. There's a bit of a break in the summertime, and there'll be two more residency weeks. One is a global week in June. Another is going to be another week of residency in July. And then it's back to that every other Friday, Saturday format until the end of the program, 22 months later when you graduate. If you're selected as a fellow, it does add some additional time. And so the way this works is that there'll be 2 days of immersion. We talked about this in our talk today, but the fellows come in a little bit early. They come in June of their year, a little bit about a month before the program starts, and they're going to do a 2-day fellowship immersion. It's going to be the students from the first year, from the second year, coming together with leaders in health equity, looking at the local, the state, the national level, really, and trying to build that community of peers and really kick off that program. In addition, it's not every class weekend, but there's 10 Thursdays per year where you'll be coming in on a Thursday evening. Usually there are some full day Thursdays that will be at the Commonwealth or in other locations, but it is additional time. So when you're thinking of this, this is, more than 60 days out of the office that you're going to be coming to campus. It is a number of trips to Connecticut. So it is, like we said, it's a rigorous program, and it does require you to have that ability to make these trips in addition to holding your full-time job as well. When you look about our fellows, I love this picture. Everybody, they color coded their outfits, which I always think is fun. They said that was the Skittles outfits, which it's always nice to see that. But really, these are for healthcare professionals that are committed to making a difference. Physicians, yes, dentists, nurses, nurse practitioners, physicians assistants. We've had licensed clinical social workers. People that have really had that experience, in a clinical background at some point in their career. It is one thing I do want to point out. It is primarily focused on the U.S. healthcare system. I know there was a question that came in about an international. The EMBA program, of course, will cover international healthcare, but the fellowship, just by the way of the support mechanisms in place, it really is focused on the U.S. healthcare system. This is a QR code. I'm not sure if you're able to scan that. You can get right to our page that will show the Pozen-Commonwealth Fund Fellowship. The webpage goes through a lot of the details. There's bios of all of our fellows there. There's some more details about the application, but really it does give you those skills that you're going to need to tackle some of these major inequities in the U.S. healthcare system. Briefly, I do want to touch on the admissions process. Like I said, we have a lot of other much more in-depth and detailed webinars. We're going to be hosting actually one on the EA about taking the test tomorrow. So I invite you to attend that as well. But these are the components of the application. The application opened last week. And so if you are interested, I highly recommend submitting an application. For those that would like to be considered for the fellowship, I would again recommend very much a round 1 or round 2 application. In some years, we will select fellows from all 3 rounds. Some years, maybe all of them are filled by the end of round 1 or round 2. So as we sit here at the early part of the year, I'd strongly recommend an early round application. You can see some of the components that are there. With a resume, there are 2 EMBA essays. There are 2 fellowship essays. One of the essays for the fellowship is to talk about your possible idea about a future capstone project. We do have some articles on our website, and I host monthly webinars that are much more casual. They're just simple Zooms where you can be on camera and we'll all be on camera together. And I go through in great detail some of our past fellows' capstone projects so you can get a good sense for what people are doing as part of this program. But that is part of the application, is to provide kind of a background of what you'd think you would like to do as a possible capstone project in the health equity space. And that'll be talked about a lot, especially during the interview process. For the EMBA application, we do require 1 letter of recommendation. I would strongly recommend at least 2 for the fellowship. And these should be people who really understand your work and know about the work that you've done in both the kind of the clinical sphere as well as the health equity space. We do require an exam from everybody. We accept the EA, the GMAT, or the GRE. Like I said, tomorrow we're going to be hosting a webinar with GMAC about the EA. That'll be up on our website as well. And you can see the transcripts, and employer approval is also very, very important. The round deadlines are right here. We do have a lot of opportunities for you to engage with us in a variety of different ways. Hopefully, Malik, if you would be able to post the link to the pre-assessment request into the chat. But I would highly recommend you submit a pre-assessment request. You can use either your resume or your LinkedIn profile, and either myself or one of the members of my team will personally review it and get back to you with some next steps. We will be having information sessions coming up on campus. The next one's coming up for our next class weekend on Saturday, August 29th. And then we'll have them throughout the fall and the winter and into the spring of next year. So definitely, we always host these during a class weekend. So they have the ability to come in, meet our current students, go to a class, meet the admissions team. It's a really great way to learn more about the program. Like I said, we'll have a number of other webinars that'll come up. I have a couple of future Pozen chats that are just Zoom chats where we can talk in great detail. I'll have one that's going to be happening at the end of August, and then one in September, and then pretty much every month. So again, if there are any questions about the admissions, I'm really always happy to help either myself or one of my team. emba.admissions@yale.edu is the best way to get in touch. So with that, I just like I said, that was a very, very quick speed admissions presentation. We wanted to be, cognizant of our time together. So I just wanted to thank Wendy, Howie, Marcella, Nazleen, everybody for being on the webinar. Rosanna as well, and have been listening in, and our assistant in the background who has helped running everything here. Please reach out if you have questions. If anybody has any parting words, please feel free. But I really want to thank everybody who was in attendance today, and look forward to talking with you at some point in the future, either online or in person.
Thank you, everybody. Good luck.
Thank you.
Thanks, everybody.
Thanks. Have
We
a
look
great
forward
rest of
to
your day.
seeing you. Take care.